saw you walking around. I was like, oh, does she need me? And she can't get through.
I was going to ask him how I could get this in.
Oh, yeah. Just push him around. It's fine. Good. How are you?
How are you guys?
Now, wait, no.
I would say more
This is why I have my phone. My husband's like, why did you do
Good to see you.
I usually see you out and about.
It's good to see you.
You're still out and about?
Yeah.
Yeah.
This is my old plain dealer day.
Mm-hmm. Yep. It would be nice if they had that. The interview should be okay.
Oh, are you
I just
guys?
have a snore. I didn't bring my light. I wasn't expecting to sit down. I thought we were over the shoulder and I got a time today. Yeah, I'm shooting this, handing off the car. No, that's okay. Really small. How's that going? Yeah. It's better than being on a jiggly highway. Yeah, that's true. Yeah, I hate to ride the wobbles. The only person I care about is our food. The reporters just be like, like no apparent reason to get on the big bed. A few times that I've chosen not to do rising, which works out well. Video, photos, Hey, to the
there
center.
if you want to
And we were like, no,
snag it.
get the big one. Keep just budgets. Especially if you got children. Yeah. Oh, yeah.
Just no bald spots, right?
I should
You know, sometimes someone takes a picture of the top of your head and you're like, what is that? My husband is notorious for that, for like taking pictures of their kids, and like I just see the top of my head and I'm like, what? Like, tell me about my hair. Right?
Today, we got a little bit of funk today.
Right, yeah.
Mostly got.
Yeah, yeah.
But they bought the station because they got a deal. Somebody that was trying to buy a car, they were selling it. There's no double. It just goes in.
You and I were late. Right, yeah. They're gonna have it right up in front.
Without them, and then I could have bought it and then leave it. So they had it down.
But they said it was
It's really pissing off.
and then
I just asked him, he said, "You're going to get Sarah and play." I'm like, you wouldn't fix the ones that allowed me to do that.
Good morning, and thank you for joining us on this very special day. We all know that the mission of Cleveland Clinic is caring for life. We do aspire to be a lifelong partners to all of our patients that we serve. And we know that it can be very challenging for women to navigate healthcare in their midlife. We all know that women tend to focus on the health of their families much more so than they tend to focus on their own health, and not just their families, so their friends and people who are close to them. 80% of women in their midlife, in particular those above the age of 55, had at least one chronic condition. And these are just some of the factors that have motivated our approach to how women will access care. Our opportunity is to transform the care for our patients. Now today, I would like to introduce two leaders who need no introduction, so my job is going to be very easy. Maria Shriver, you know as an author, journalist, an advocate, the most enthusiastic advocate for Cleveland Clinic, for which we're very grateful. And she's also a champion for women's health issues. Now, Barry Ridgway is also here. Now, everybody here knows Barry. Barry is our chief of staff, and Barry and Maria share the enthusiasm, unbridled enthusiasm for women's health issues. So they have brought their vision to life, and now this vision is becoming a reality. Today is a big day for Cleveland Clinic. It is a big day for women's health because we are officially opening Cleveland Clinic Women's Comprehensive Health and Research Center. The center is designed to address the issues that we just spoke about, to help women thrive into their midlife and beyond. And the core pillars of center's framework will be access, education, connectivity, and research, plus sustainability. Our priority is to help women in this stage of their life answer one simple question related to their health. And we have heard it from our coordinators earlier today. And the question is, where do I go from here? So please join me in welcoming Maria Shriver, our Chief Visionary and Strategic Advisor for the Cleveland Clinic's Women's Comprehensive Health and Research Center, and the founder of the Women's Alzheimer Prevention and Research Center at Cleveland Clinic. Maria, please. Thank you.
Thank you so much, Tom, and it's a pleasure to be in beautiful Cleveland, where I understand that I'll see 4 seasons all in one day. So I'm hopeful that we're in the spring and there is sun out, because this is a historic day in Cleveland Clinic's illustrious history. Today is a day when the Cleveland Clinic signals to the world, first to the people here at the Cleveland Clinic, but really to the world, that from this day forward, it is the preeminent home for women when it comes to their comprehensive care. Today is the day when Cleveland Clinic says we want to be known as the place that offers the gold standard of care for women at every stage of their lives. It's a big and bold and brave assertion in a time when we need big, bold, and brave ideas. I've always believed that our nation needed a first-class, comprehensive women's health center, and now we have one. That's huge, huge. I didn't grow up with one, I never saw one, I never went to one, and now you are building one that will be known around the world. Over the past several years, I've been honored to work alongside so many talented and passionate doctors here at the Cleveland Clinic to bring this vision to life. This is a place for women at every stage of life, where they will feel seen, where they will get the research that they need, the care that they deserve, care for their brains, their bones, and their bodies. I'm especially thrilled that today also the WHAM Prevention and Research Center also expands, as it so deserves to do, so that it can serve more women, educate more women, and ultimately, I believe, decrease the number of women who are diagnosed with Alzheimer's. We can make a dent in the number of women who get Alzheimer's, and that also starts here. Bringing attention and resources to women's health is my mission and my passion. We cannot solve the Alzheimer's crisis unless we know more about what happens to women at midlife. We can't help women who are struggling with autoimmune diseases unless we fund the research to tell us what is causing them to be so sick. Every single woman I speak to, no matter where I go, tells me the same story. I cannot get the answers I need to help myself, to help my mother, my sister, my grandmother, my daughter. I was one of those women. My mother was one of those women, as was my grandmother. All of us had and have questions about our health that our doctors just couldn't answer because they didn't have the data. They didn't have the research. That is what has fueled me, driven me, pushed me to press for change. Change at the local level, the state level, and finally now at the federal level. At an event a few months ago, the Secretary of the Department of Health and Human Services introduced me by calling me a pit bull. At first, I was rather taken aback because I'd always seen myself kind of like a golden doodle. But then I listened to him and I went and looked at the attributes and the qualities of a pit bull. It said pit bulls are protective, they're loyal, they're aggressive, they're smart, they show devotion, and they're intelligent. They're fun-loving companions, and they're used to fighting. It went on to say, when they are well managed, they're great for families. And how do you know if they don't like you? They avoid eye contact. Female pit bulls are smart and loving, they're affectionate, they're strong, they're powerful, agile, resourceful, and driven. Determination is their most notable trait. Well, my friends, I now accept that descriptor with pride. In fact, I would urge every single woman I know moving forward to see herself exactly like that. So all you pit bulls out there, welcome. So whether you are the patient or the advocate, you must be determined when it comes to your health. You must be a fighter. You must be relentless when it comes to getting answers. You must fight for what you deserve, and you must see yourself as a loyal partner with your doctor. Doctors and nurses and navigators and caregivers, they cannot do this alone. They cannot help you to get the help you need unless they hear from you, unless you tell them what is going on. So today, consider the days of neglecting yourself as over, the days of accepting what was as over. If you and we together want to write a new story around women's health, one we must write it together. Too many of our sisters live without access to care. Too many women feel invisible. They are too afraid to speak up. They doubt themselves. They doubt their symptoms. They doubt their own stories. We've got to change that. What's in your head, what's in your body needs to be validated. It needs to be expressed. Today is a day to stand up, to be heard, to be seen, and to allow yourself to be cared for the way you would want someone you love to be cared for. If you want to be a part of a sea change, which is what's going on here, you must get in the water. You can't stand on the shore. Making waves and understanding that the waves you are creating will bring help and hope to millions of women. It will bring the help and hope that they deserve and that they have been waiting for. So I say to everybody here and to everybody listening to this, let's go. Let's get off the shore and get into the water. What is happening here is a wave. None of this, of course, would be possible without the incredible, powerful, and leadership of Barry Ridgway. She has been a partner to so many people here, and she has been a partner to me along this path. I have learned the word sustainable from her. It's been irritating, but I get it. Evidence-based, sustainable, it's in every conversation. I'm like, let's go, we got a deadline. Let's move it along, Barry. But anyway, her dedication and her commitment to jumping into the water, even when there have been rapids, is really inspiring. And it's been such a joy for me to tour around the clinic today to meet so many other incredible doctors who have been in this space for years and decades, who went into this space to help. This is a big moment for everybody here, but really it's a big moment, I think, for women around our country. And I think that's an incredibly exciting thing to see come to life. I've always believed, and I'm so glad to see Jessica Caldwell, who has led the Women's Alzheimer's Prevention Center in Vegas. And that has been also one of those things where everybody's like, that can't happen, that's not gonna work. And I'm like, we're in the water, let's go, let's go. And I'm so proud of your leadership and the work that you've done there and the expansion that is occurring here. Because, as I said, as I traveled around trying to understand Alzheimer's, first I was like, everybody told me it didn't discriminate against women. It wasn't disproportionate to women. I'm like, I don't think that's right. And then when we changed the narrative around women, around Alzheimer's, put women at the forefront, I was like, well, what's happening to women at midlife? Everybody's like, well, we don't know. We don't have any research. I'm like, how could that be? How could that be? How could we not have a comprehensive women's health center? How could we not have a federal initiative to address, how could we not have billions of dollars to fund women's research? It's all changed, like in the last year, and it's 2024. So it's exciting. It tells you things can get done if you get off the shore. And so I want to congratulate you. I want to thank you. I want to shout out to all the work that everybody here has done and will continue to do. And I look forward to partnering with all of you in all of your different areas of expertise, because women's bodies are different. Our health span is long. The challenges we face are complex. And if we want to make life different for our daughters, our sisters, we've got to get going today. And so I'm so excited that we are getting going today. This is a historic day, not just for the Cleveland Clinic, but for women everywhere. So it's my pleasure to introduce my partner in crime, Dr. Barry Ridgway. Thank you. Thank you.
Well, thank you, and thank you to Maria. Really, you are my very favorite pit bull. This is exciting. This is an emotional day. This is something that in my life I never thought would be something that happened in my career. I thought this is something that we'll work on laying the groundwork for so that the next person can do this. So to be here and have this happen at Cleveland Clinic, mind-blowing. Your advocacy, your partnership, all of the attributes that you shared, totally true, and this really has been a wonderful give and take to make this happen and make it sustainable. As a gynecologic surgeon and a leader in women's health, I have had the honor of working with thousands of women to address their healthcare needs. And over the last 20 years, I've identified significant gaps in the way healthcare and women both intersect and interact, which has motivated us to think differently. How can we get to midlife and beyond and be healthy and age in a healthy way? We created this center for one purpose, and that is to close these gaps by meeting women where they are. To do that, we asked them, we surveyed more than 3,000 of our patients to make sure that we understand their needs and their preferences. We learned a couple of really important things. over half of women responded that they find a lot of misinformation about women's health, especially online. Over 70% completely agree that there needs to be more research on women's health. Nearly 80% would use a patient navigator to access care in women's health. Nearly 80% would access credible education sources from Cleveland Clinic. And nearly half wish they had a community to talk about women's health issues. So we listened and we created. Access, education, connectivity, and research are the overarching themes we are focusing on. And these are common themes in healthcare, but we're approaching them differently. The design of the Cleveland Clinic Women's Comprehensive Health and Research Center is unique. You will notice our front door, which we call our Welcome Center, many members here today, it's simply a phone number. Every patient who enters this center is teamed up with a patient navigator. Many of the navigators are here today. Give a shout out over here. They listen, guide, schedule, connect the patient to the care that they need. They help close those gaps. They are a passionate group who truly care. This is a game changer. Patients will experience connectivity to reliable health information, to group appointments, to research, and to the right care that they need. And when it comes to research, I echo Maria, and we will continue to shout these from this rooftop and all others. We need more research. We are committed to that. We are committed to more research, and I'm optimistic that we will be an integral force making this happen far beyond the walls of Cleveland Clinic. We are honored to announce the official launch of Cleveland Clinic Women's Comprehensive Health and Research Center. Now I ask that with all of us up here, we are going to go ahead and welcome the clinical specialty leaders who make up the center. The areas include menopause, prevention and healthy aging, primary care, women's Alzheimer's prevention and research center, women's cardiology, behavioral health, osteoporosis and metabolic bone disease, and endocrinology weight management. So come on up. We are going to be doing a ribbon cutting. As we set this up, I want to thank you all for what you are doing to change the way we approach healthcare and research for women. And I want to thank the many, many caregivers in this room who have brought this vision to life. Uh-oh. We appreciate you and could not have accomplished this without each and every one of you. I told you about the scissors. Where'd you get these? Put into that. Okay, perfect. That's okay. We can do it together if you're willing to share. Maria, I'm going to let you do the honors of the countdown. Yes, and we will do this all together.
Yes, well, I have to say, Tom said to me when we were walking around at Cleveland Clinic, they say if you don't cut, you don't count. So
Exactly.
I guess we're going to count today. This is it.
Exactly.
That's right.
Today.
All right, 3, 2, 1, cut. Hey, congratulations.
I wasn't listening. Oh yeah, they turned it off. Yeah, they turned it off.
Thank you.